I will introduce Dr. Zak Goodman, who is our presenter for today. He is a local Jewish boy who is very active in Jewish events and causes here in town. That's how I actually came to know him, through my brother, Rabbi Shlomi, who's in Chabad of Paradise Valley. And we're very fortunate to have friends like this. I'm very fortunate to have friends who will present on their knowledge, expertise, and I think this is always a great subject of living better without taking medicines to the best of our ability is definitely one of those, I think, models and mindset of chiropractors. So if I'm wrong, Dr. Goodman's going to correct us all on that. But if you don't mind just sharing a little bit about yourself, and then we would love to hear all about chiropractic in general.
Sure.
So thank you.
Of course, yeah. I appreciate you having me on here today. Let's see here. Rabbi Levy, thank you, and I'm honored to speak to all of you. So I apologize. There's no PowerPoint. My computer broke last week, so I went to get it fixed, and I just got it about maybe an hour or so ago. So I'll just have a lot of movement and stuff, and hopefully that keeps all of your attention. But I am Dr. Zak Goodman. I'm a doctor of chiropractic. I am a certified strengthening and conditioning specialist, and I'm a movement specialist and the proud owner of Goodman Human Performance. So yeah, a little bit about me. I'm from New Jersey, born and raised just outside of Philadelphia. I'm actually honored my wife and my mother are here, which is pretty cool. Mom, raise your hand if you will. Thank you. So I moved here in 2017, and I married my now wife. She's from New York originally, but we met here in Phoenix. And we have a bunch of plants, but no pets and no children yet. I know a lot of people wonder when you're going to have kids, and none yet, but we're planning on it. So no worries, everybody. Professionally, I've been working in the wellness and health and wellness and fitness profession for over 10 plus years. I have trained the general population, as well as seniors, special populations, being those with mental disabilities, as well as just all populations through whether they're healthy and just want to better themselves, or through physical therapy. So if they're hurting, I've helped them get to where they'd like to be in that sense. So I went to chiropractic school in 2017 in Marietta, Georgia. In 2017 I graduated. I went there in 2013, and now I'm enjoying and working on everybody out of my own clinic. So is there any questions about that? So, all right, so while chiropractic is a big part of what I do, I call my practice Goodman Human Performance because I help patients get to where they need to be and then hold that there. So having been a strengthening and conditioning specialist, and having worked in physical therapy for a good amount of time, what I do is I utilize all of that knowledge to help patients not only just feel better, but move better and function better. With that, I'll be talking about chiropractic care and how it pertains to pain, posture, the nervous system, and the immune system, because I think that's kind of important with what's going on with COVID and everything like that. And then at the end, I'll give you guys a couple of pointers on basically how to boost your immune system through a couple of easy things you can do at home. You've heard of them, but they're pretty unique and pretty easy. So hopefully you'll be able to do them. But Rabbi Levy, is there anything you want to say before I get started?
No, you're doing well. Perfect. This is what we want to hear.
All right. Awesome. So has anybody ever received chiropractic care before or is receiving chiropractic? See a couple of people.
Doc, do you see the full gallery view?
I do see I see the gallery and people who are showing their videos. Also, feel free to chat. You know, you guys can ask questions and chat on there. I have a general outline of what I want to talk about, but sometimes I stray from it. So especially if there's questions, I enjoy answering them. So we'll start off with you know, how it pertains to how chiropractic can help with pain. We've all heard of that, and how it can help with things like neck pain and low back pain. But first, I want to kind of clarify. I know we all have felt pain, but what is it exactly? And you know, there's different types. You know, we have aching pain. We can have achy joints. We can have sharp pain. That typically means something kind of is a little bit more immediately wrong with something. We can have burning pains. Usually that's something going on with our nerves. And then we can have throbbing pain. That can be have something to do with typically arterial or basically our blood vessels. And these are different ways just to kind of become a little bit more familiar with our body and kind of how it works. I know when we tend to have pain, there's an emotional response. And sometimes when we can make it objective, when we can objectify it, it becomes a little less emotional, and we can look at it from a good point of view and solve it a little bit more readily. But pain is a healthy response to an injury. So the reason I say it's a healthy response, while something can be wrong, while it may not be pleasant, the body is working the way it should. And I say that because I don't know, hopefully nobody here has had cancer or anything like that. But if sometimes, for the most part, if you have cancer, usually you don't feel any of it until it's invading on other tissue. So that's not a very good response, unfortunately, for something that can be so dangerous. So when you do feel something, you do feel pain, it's a good thing. So when there's an injury to a certain a given body part, blood rushes to that area and causes inflammation, which is swelling. I'm sure we've all had bruises and swelling and stuff. And then it brings hormones that allow us to feel that pain. And the crazy, the thing about all this is, while you may have pain in a certain area, it's kind of that blinking red light. While you may have pain in that area, it doesn't always mean that is the place of injury. So typically what happens is if we have, let's say our shoulder hurts, right? And we're kind of like, we sit for long periods of time, or we exercise too much, you know, one or the other. Either way, say the shoulder hurts, that can be a victim of something else going on. So I'll show you here. Let's say this rubber band represents the muscles of my shoulders, okay? So if we're sitting and we're on our computers a lot, or we're on our cell phone or reading a lot, what happens is we start to get something called forward head posture. And all of this rubber band here, our head starts to fall forward and this muscle starts to stretch. And the muscles in our neck tend to start to stretch out as that head falls forward. And what happens is we get pain there. And typically that muscle, while it's stretching, it's saying, we can't stretch anymore. We've stretched too far, we need to lock down and tell this person that something is wrong. And so it becomes painful. So what I do is, with that pain, we look at the posture. If everything's falling forward, we'll look at that and say, well, what exactly is going on? If I push on this continuously and the brain is saying and the body is saying, I can't move this any lower. If we push on it, it can make it worse. That's why we tend to have these issues here, and we always push on it for weeks on end and it doesn't go away. So what we have here is if those back muscles are lengthening, these are going to shorten. Okay, and then we have this scrunchy thing going on in the front. So we want to open that up. And that takes the stress off of those back muscles. Does that make sense to everybody? You can give me a thumbs up. You can, cool. So what we do is we'll work on that. That's some of the things that we do. What can happen is the joints of the spine are still locked down. We think of things like a muscle issue or a joint issue, but it's all one and the same. Our body reacts to traumas, whether they're big, small, kind of as a whole, right? So we will loosen this up, but then we're still stuck in this position. So I'll put I'll make a chiropractic adjustment on a certain point in the spine, and that unlocks the joint. And that tells the joint that it's okay to move. Because usually our joints become fixated and stuck and all that stuff from things, whether it's throughout life, like I said, traumas, big and small, whether it's a car accident, you might have fallen on your butt when you were a kid and never got adjusted, or sat at a desk for years on end. But that can also include emotional type of traumas. So if we receive let's say an insult from someone or someone we love, just kind of like I always have a dog who tucks its tail under itself when it's been reprimanded. And so it tucks its tail, it drops its head. When we receive an emotional insult, we either absorb it, right? We'll absorb it this way and we'll get stuck this way, or we'll face it. Either way, it's not, neither is bad, neither is good, it just is. So we'll absorb it and we'll get locked in that position. So when a chiropractic adjustment is delivered, it brings our body back into the present, where we may have held on to this injury and it served us properly. You know, we were able to receive it and still stay standing and move forward in life. But when we deliver that chiropractic adjustment, it takes us out of the past and it brings us right back into the present and says, I can now open up. I can now breathe. It's okay. That thing's not there anymore. So same things, if you have anxiety, it can take you out of this, future thinking and bring you back to the present. And that has to do with something called, the autonomic and sympathetic nervous system, which will bring me into the next part of what I have to talk about in all of this. Is everybody keeping up all right? I know it gets a little intense and gets a little deep sometimes, and it's a lot of information. Everybody good?
And just to jump in, if anyone does have a question and you're not comfortable with the chat, definitely unmute when you hear something that you just want some more information about.
Yes, please. I do enjoy questions. So to kind of ground this whole thing, it's easy to talk about emotional and physical traumas and how it affects, but what happens is, I mentioned the sympathetic and autonomic, or sympathetic and parasympathetic nervous system, which is part of the autonomic or our automatic responses to our life, to our environment. Sympathetic is not, oh, I feel bad for you, I'm sorry to hear that, Sympathetic nervous system is our fight or flight response. So if somebody were to, or if, like, let's say as humans evolved, we needed to face a lion, right? And a lion's gonna attack us, or we come face to face, we either run or we fight. And then you have parasympathetic, which is rest and digest. So When you receive an adjustment, again, it brings you back into this present moment. If we're constantly doing, or we're constantly stressed about issues or anything like that, it takes us out of this sympathetic state, fight or flight, like what's going to happen next, oh no, what do I do, to this parasympathetic state, which is I'm okay to relax. There's nothing harmful going on. There's nothing harmful in my way. I can chill out, and all our blood goes into our digestive system, our brain. Basically, our blood goes from the outside back into the inside. It warms us up. The reason that works with a chiropractic adjustment, as far-fetched as that sounds, is because that adjustment moves a joint. So we're stuck like this. It moves a joint, sends a signal to the brain. The brain says, oh, I remember you. And then it sends a signal back saying we can move. But that signal needs to pass all the way up through the brain to the certain spot where that joint is located in the brain and back down. That's including our emotional nervous system, the parts that tell us our body, things like make sure you're breathing normally, make sure your blood pressure is regulated, make sure your heart rate is pumping normally, make sure your body adjusts to the 115 degrees outside so you don't pass out. So that stimulus right through the spinal cord up into the brain and then back down turns the brain on. And it can help with mental clarity, cognition, all of those things, which when we can respond to our environment better, we can adapt to it better. And adaptation is a big part of what we do, because when we don't adapt, then we try and control things. And when we know we can't control things except for ourselves. So that allows us to almost relax a bit better into our environment and be okay with everything and calm down. Does that make sense to everybody? Thumbs up?
Yes.
Okay. Again, I know it's a lot. It's pretty cool. I find it pretty interesting. And that does lead me into the immune response. So, if everything is regulated, everything is regulated by the by the nervous system. It goes up into the brain. The brain is what releases hormones, all that stuff. And we can adapt better to the world around us and our environment. Then our body can respond more properly to a possible invader or virus. There's a handful of things that kind of go into that, but it can it's a proactive. Chiropractic is a proactive treatment for instead of a reactive treatment to what there possibly is to come. So like I said, it allows your body to adapt better to a possible invader. If your immune system is regulated and can respond to various things more properly in the present, then it's more ready to fight something off instead of the unfortunate latter, which is to shut down. Does that make sense? So a chiropractic treatment can consist of a few different things. I know you guys, I don't know if you guys have ever seen one, but usually you think of the person taking a chiropractor taking a person's neck and maybe twisting it any which way and all that stuff. And but I assure you, I'm not a trained killer. I went to school for quite a few years to learn to do that. But also, there's as they say, there's more than one way to shave a cat, right? So you have your traditional chiropractic adjustment where you might hear that noise, that pop. And what that is just like popping a champagne bottle. The pressure goes from high to low, and that's what happens within the joint. So it's not your bones that are cracking, it's the pressure. Every joint is kind of surrounded by a bubble of ligaments, wraps very tightly. And when that bubble of ligaments is just pushed a little bit further, air can escape from it, and it makes a little popping noise. So that kind of helps a lot of people kind of be a little bit better about that. But also, there's light adjusting tools that can help people that don't make that noise, if that's what scares you. And it creates a light, there's light thrusts that, again, just the brain that the joint is there, that the joint it's okay for it to move, all those things. And that's what I actually use, some very light tools, both on seniors if necessary, but also those same tools I found more effective with my patients that are in the military or police officers, because their first response to a big movement is to guard, right? They're in that sympathetic state. So their first thing is to guard, and I'm not going to overpower a guy that was in the military. So I use these light chiropractic adjustments on these patients, and they don't perceive it as a threat. And it's doing just as much as the adjustments by hand. So that's pretty cool. That's something I learned on the streets. So with that, I'll get into what has been my new and favorite part of the learning experience. Are there any questions at all? Okay, we'll save them till the end. So three things that you can do to reduce pain, increase your immune response, decrease inflammation, all of that stuff. It's easy. I'm not asking you to exercise and stretch, even though that's all good or better. All of those are phenomenal. Don't avoid doing those things. But the first thing I would recommend doing is going outside. Obviously, when it's maybe a little bit cooler, you can start, or you can start today when the sun's going down. But walk outside barefoot in the grass for 12 minutes a day. This is called earthing or grounding. I think they just gave a name to walking around barefoot, but I like it. And what that does is, if you think of people like batteries, we need to recharge our batteries. We fill up with what's called, I don't know if anybody's ever heard the term free radicals, but that's a positive charge in the body. And that positive charge creates inflammation in the joints, which can lead to arthritis. It creates, it can make our blood coagulate, or it can make our blood thicker, and things like that. So when you touch the earth, it pulls that positive charge out of your body, replaces it with a negative charge. That negative charge is used for more energy, and it can thin our blood a little bit. So that thinning of the blood can, I know, some of us might be taking some blood thinners. So you might want to be careful and check with a physician if you're going to do that daily, because it's actually quite effective. If you don't have grass or dirt nearby, anything like that, walk on the ground. You can walk on the ground as long as it's not carpet, but touching the ground is very with your bare feet is very beneficial. The next thing is, while you're out there, I typically recommend, if you're an early riser, to go outside and kind of hang out in the sunrise, or if you go to bed a little bit later, if you can, stand outside when the sun is setting, with about 5 or 10 minutes within the sun rising or setting. The reason is, how has anybody? I'm sure you've all been able to watch the sunrise or sunset at some point, and you can actually look at the sun during those points in time, right? So as opposed to when the sun is directly overhead, if you look at it, it burns your eyeballs. You just can't do it. So when you're when you're staring at the sun, during those points in time, the light of the sun is hitting the earth a little bit differently, and we're getting different wavelengths of light. And that tells our body either to, in the sunrise, wake up, it's okay, start getting everything moving, you know, turn the liver on, turn on your digestive system, you're gonna be eating, you know, and then as the sun is going down, it tells our liver, okay, you can start to go into recovery mode, start preparing for bed, all those things. So it regulates our ability to sleep and wake up better if we have sleeping issues. It helps our cells work better because of the wavelength of light. It's red light, or more red than blue. And red light helps our energy, the energy centers of our cells to work better. When I say energy centers, that can be of any part of our body. That can be our eyes, our hair follicles, again, our liver, our skin. It can help rejuvenate the skin. All those fun things. It's very good for you. And sometimes I tend to try and hit two birds with one stone, and I'll stand out in the grass while I watch the sunset. Okay. And then the last thing is breathe. We always forget to regulate our breathing. Like I said, it can bring you back to the present. Sometimes we pick it up, or we see something on TV, or you know, again, right now with coronavirus, it can be a little bit scary, but as we breathe, the body works better when it breathes. That's the ins and outs of it. They used to say, you know, breathe in through the nose and out through the mouth. But now the most current research states in through the nose, out through the nose, because the nose is for breathing and the mouth is for eating. And there's some hormonal or regulatory changes when you do it all through the nose. The body more readily uses oxygen when it breathes through the nose. If you want to get a little bit more advanced, you want to breathe steadily and slowly, enough to where the person, if you were sitting next to somebody, that they might not hear you breathe. We have earthing, red light, or looking at being outside when the sun is going up or down, and breathing. And all of those things can help you feel better, function better, help your immune system work better. And that's it for today. Dr. Zak Goodman with Goodman Human Performance. I hope I didn't put all of you to sleep, but I do appreciate you guys listening. So thank you.
I don't see anyone sleeping. So. First of all, there's a question in the chat, which was really about the standing outside. Standing on a towel on artificial turf, meaning would that ruin the effect of the standing on the grass, or?
I would say the artificial turf is okay. I wouldn't do the towel. Obviously, if it's too hot, I would probably recommend just finding some cool tiles in your house and standing on the bottom floor of your house and standing on those. Yeah, if you don't have any of that nearby, probably as it gets cooler, you can stand out on some of the cement, or if you can, if you have rocks or something, you can do that too.
And someone wrote in the chat that she has a yoga teacher who always tells about nose breathing, like what you just mentioned, and she finds it hard to breathe out that way.
Is it difficult because it's stuffed, or is it difficult for any other reason? Is it your lungs?
Janet, did you want to unmute and answer that, or?
Mostly because I think I'm just used to breathing out through my mouth, and it just feels like, no, I'm not stuffed. It just feels like I'm, I don't know, just.
Yeah, when you're changing.
It's used to, it's a habit.
Yeah, you're changing how you breathe. breathing is the first thing we do when we get to this world and the last thing before we go. So it's very ingrained in our brain. And when you change that, it can be quite uncomfortable for a little bit. So I would say without any other or issues or anything like that, practice for a short period of time throughout the day, or you can remember, and that will start to work you towards it. Also, you can do to practice is, let's say you're reading a book or watching TV or anything like that. You can take a sip of water and just hold that in your mouth. And that kind of forces you to breathe through your nose a little bit longer, but also you're not forcing your closed. And that can kind of train to breathing through your nose more.
And also with the breathing, yoga, she does this, she zooms into us twice a week, and it's just fabulous. And breathing, when she says breathe in, I tend to hold my stomach in, and it's just the opposite. So that is just, you have to be more mindful of doing it.
Yeah. Again, I say, I typically say belly breathing is for sleeping. Because when we sleep and lay on our backs or our sides, we breathe more belly because it's easier. But actually, when we're awake and moving, we tend to breathe in more actually into the chest or the entire thing. So both the belly and the chest together. But you don't want to breathe into the shoulders, right? So it's just a gentle breathe to where your rib cage is opening up all the way around, and that's something else you can focus on. You don't need to breathe in all the way, keep it gentle, and just try and expand your cage all the way around. Some things I do to practice that is I'll lay on my back and I'll put just something, maybe a weighted pillow or something, right over the chest, and just work on lifting it and bringing it back down. Yeah, belly breathing is for. Does that answer your question?
Thank you.
A question for you that came from the chat, and then a question that came from Facebook. The question that came from Facebook was about, what about sciatica? That was her question. I guess maybe what do you say about that?
It's a good question, and it's a loaded question. Sciatica can happen from a handful of things, different issues. It can happen from one. It can happen from multiple. So I would recommend seeing somebody, or obviously you can see me, and see if we can help you with that. Okay,
and then I put your website on to the chat. Somebody asked if you take insurance.
I'm sorry, I don't take insurance, but what I've done is I've reduced my rates for them to be affordable and comparable to a copay or co-insurance. I don't take insurance, I don't take Medicare, but I provide a general service with great customer service. I care for you, so I'd like to think that's.
Now, let me ask you another question. Since I'm looking at your website, I know your practice is in Mesa. Yeah. Do you ever do, concierge chiropractic visits type of a thing?
I do when I do if it's deemed necessary. That is a little bit more. I do have that available if somebody really is in bad shape.
Okay.
Levy, I have a question.
Sure, go for it, Steve.
Yeah, if you have round shoulders and poor posture, is that something that can be corrected permanently?
It's something that can be corrected. Of course, I always say, I don't like to guarantee anything because we always have the limitations of matter. It depends on how long we've had it, what's going on, if there's degeneration or any other issues involved. But yes, rounding shoulders is quite fixable. Honestly, I'll continue to say it. We're creatures we adapt. So the life we live is to adapt to sitting in front of a computer or down, will. If most of our life is looking great and standing up, or if that's what we continue to do, then it's hard to do that. That's the easier answers, and but sometimes we obviously need some guidance in the right direction if things are locked up and locked down, whether it's, again, physical, emotional, any of those sorts. So, and we breathe into the shoulders because that creates stress and neck pain. So when we're running, we breathe into the shoulders. That's locking our shoulders and our head, making ourselves look bigger, and can cause that tightness in here, which get a lot of stress already, kind of from here. So they're definitely a victim. So you don't want to breathe into the shoulders. You want to breathe into your diaphragm, which if it hasn't been done for a little bit, you can do some breathing techniques to retrain that. But again, with any change, change can be uncomfortable. It takes a little bit of time. It takes a little bit of energy, but it's worth it. You'll be happier and you'll feel better if you practice it.
Thank you. Any other questions? Ellen, I see that your mic is unmuted. Did you have a question?
I was just wondering, when you were talking about breathing, were you talking about deep breaths? Because I remember the yoga teacher said, if you want to lower your blood pressure a little bit, to take deep breaths.
To take deep breaths, it would, there's a couple of thoughts. So deep breathing is pretty good if you're doing it properly. Again, if you're breathing into your shoulders, that's not the best. But ideally, what you want to do is breathe gently to a capacity where you feel comfortable. And then every once in a while, deep breaths are actually very good to strengthen those proper breathing muscles. So I would say breathing is good, but not all the time. You want to, if in a relaxing setting, typically you do want your breathing. It's kind of how the body works. If you're running, you take deep breaths. If you're hanging out, if you're sleeping, you want calm, slow, gentle breaths that don't put stress on the body, right? So I would think yoga tries to almost straddle that line between, sleeping and awake yet moving. So you do want to take some calm, gentle breaths.
Thanks.
Thank you. Charlie, did you have a question?
Yes. You mentioned a couple of exercises you might show us. This pandemic in the heat of Arizona, it's hard to get out and really exercise right now.
Sure.
Can you show us a couple of exercises that might benefit all of us in this heat where we can't get out?
I can tell you about a couple of exercises. If you're to, of course, I always say check with a doctor or physician. But if you have bands at home, kind of like this one, okay, you can hook it around a doorknob or door frame, if you can hook it around a doorknob or put it in the door, and you can do some rows, okay? You can put it around under your feet and do some bicep curls or overhead pushes. You can do things like that. If you don't have any bands or any equipment whatsoever, I would typically say push-ups or various modified push-ups. So you can go up against the wall and lean into it and do some push-ups. You can do it against a chair. a big one, like a really good one for everybody here, if it's possible, to try and lower yourself onto the ground and stand back up if you don't already exercise. You'll find if you do that 10 times, you'll have a pretty good workout. So that's a really good going.
Is that safe for seniors?
If you want to have something sturdy to lower yourself down, again, please check with somebody. If you feel uncomfortable with that, don't. I would say if you feel uncomfortable, down in a chair and stand up. Do that 10 times. That's essentially a squat there. Again, if you don't have any bands, you can lay face down, say on a bed or a bench, and just bring your arms out and just do this. You can do it this way, you can do it this way, and just using the resistance of your body and gravity to help you get some back exercises. So,
sit-ups are ruled out now, aren't they?
Sorry?
Sit-ups, they're no longer encouraged.
Correct. I wouldn't do sit-ups. It puts a lot of weight directly into the spine and really can really hurt the low back.
Okay, I appreciate that. Yeah, I've got a small band and I can use that. I never thought of using it this way. I use it on my legs.
Okay, good. If it's a small one, like a so if it's a small loop, kind of like this, you can definitely put that around your legs, but also get around again a doorknob and just do rows like that. Also, just little things like just helping your rotator cuff going out, where you can cut it and then go wide. Let's value your bands.
Okay, thank you.
And then one question that I see in the chat, do you think using your non-dominant side more helps you keep balanced?
Yes. I think it helps quite a bit if you can manage it. I try brushing my teeth with my left hand sometimes, and I look like I've never brushed my teeth before. And if I did it all the time, I wouldn't have teeth at all. So.
They have electric toothbrushes.
Thank you.
Just a point that someone wrote in the chat, which is actually really true. If you have an older band, be careful because it's dry heat that some of them break easily. So make sure you have some new ones.
Yeah, you don't want to get yourself in the eye.
That's right. All right, any other questions? I see these were some great questions. If you do have a question, feel free to please unmute your mic or write into the chat.
Yeah, I appreciate again all you guys listening, and thank you, Rabbi, for having me on. I'm honored to speak to all of you. So.
No, thank you very much. And again, if anyone is looking,
where is his office?
It's in Mesa. And Zach, do you want to share more about that?
I'm located in Mesa, right near where the Cubs practice facility is. So right off of the Dobson exit on the 202. It's essentially where 101 meets the 202, where Tempe and Mesa and Scottsdale all kind of meet together in Mesa Riverview. If you guys are curious, you can check my website. I believe it's on here. And I can give you further directions from there if you contact me directly.
Again, that was mymesachiropractor.com, correct?
That's correct.
Okay, awesome. So I put that. And again, it's Goodman Human Performance for those of you who are looking for the name of the practice. So thank you very much again. This was, I learned a lot.
Good.
And I'm sure everyone else did. Maybe I'm the least, I guess I visit the chiropractor the least, maybe. But
yeah, so even every once in a while, it's good. And so the biggest thing I want you guys to do is be more empowered by perhaps any issues or anything you might have instead of disempowered, because that's kind of what the journey is about. So, you know, I want you to know more about what's going on with your cells and your body. And so I hope you guys definitely learned something.
Thank you. Are there, and this is one last question, where do you sort of stop in the sense of the medical field or advice and then hand it off to, let's say, an MD, or I don't know what the next doctor would be for depending on the problem?
So that's a good question. For an example might be, I've worked on patients that have been here from throwing their low back out. They really, you know, their back went into spasm, they feel it down their leg, and I've worked and they've gotten better. If there's a period of time, let's say, that they're not getting better, I send them out for x-rays or MRIs, and then we reapproach it or figure out what the new approach would be. If they're not getting any better, then we start consulting a physician or another route if necessary. You know, basically, if they're not doing any better, they're either not progressing or getting worse, then I look to refer out for various things.
And is that something where you would find the referrals, or they would have to go back to their primary care doctor?
It'd be a little bit of both. I want them to have options, and but I do have people I trust. I have a patient who has had very serious vertigo, you know, and it's been reduced. However, it's not gone. So that's when I've been treating her for a little bit, and because of that, I'll refer out.
Okay.
I just want the best for the patient. So as long as they're getting better, I do like to. It's good to know where your limitations are. With that being said, you know, I do my very best, and it's pretty good most of the time, but you do have the tough ones. So.
All right, and one last question that just came in the chat. If you don't mind sharing the difference between a physical therapist and then chiropractor, sort of where they end, where you begin, where it meshes together.
Physical therapy concentrates on movement and modalities. A chiropractor typically, I'm going to say, a chiropractor typically concentrates on utilizing the chiropractic adjustment for care. We can cross boundaries, whereas a chiropractor has a little bit more experience in the art of chiropractic, and a physical therapist has a little bit more understanding of how the body moves. With that said, I'm a health provider. I'm a healer. So while again the chiropractic adjustment is a part of what I do, it's just a tool in the toolbox. And I've made sure of that. I like to make sure the patient is getting better, whether that requires a chiropractic adjustment or not. I've dove deep into how the body moves and works as to provide the best care, and have gone out on my own and called it human performance so I can provide that. Because when you're looking for a chiropractor, you kind of think about, you know what you're getting. When you're thinking about human performance, it's how you perform as a human generally, no matter what that is. So
right.
I have an ASU Division I athlete, and I have seniors. I have I have all types of patients with and they all receive something different because they're all different. So
thank you. This was quite informative. Really appreciate it. Thank you very much.
It's my pleasure.
All right. If any
guys, enjoy your week.